two infectious disease, dengue and kalazar. Okay? Both are important. Now let's first talk about dengue. Okay, now talking about the epidemiology, dengue is a rapidly spreading mosquito-borne viral disease. Right? Mosquito spread garcha, but it is a viral disease, and it's the dengue virus is a single-stranded RNA virus in the family of Flaviviridae. And there are four distinct serotypes in dengue virus, then one, two, then four. Right? So four distinct serotypes are there. And the transmission is by bite of the infected female mosquito, that is the Aedes aegypti mosquito. Right? These are found mainly in the urban areas. Jati urbanization धेरै भएको ठाउँहरुमा नै the dengue fever is more rampant, right? And it's urban areas with rainwater collections, artificial rainwater collections हुन्छ रोड्सहरुमा या घरको छतहरुमा बकेट्सहरुमा जस्तोमा rainwater collectionsहरुमा नै यिनीहरुको ब्रिडिङ गर्छ. And the incubation period is 3 to 7 days, and infected mosquitoes can transmit disease throughout their life. Or infected dengue infected person बाट मस्किटोहरुले भाइरस इन्जेस्ट गरेपछि अनि मस्किटो एकचोटि इन्फेक्ट भएपछि थ्रु आउट देयर लाइफ नभएसम्म डेङ्गु भाइरस ट्रान्समिट गरिराख्न सक्छ. एन्ड देयर इज अल्सो ओभेरियल ट्रान्समिसन थ्रु एग्स, भनेको एउटा फिमेल अलरेडी इन्फेक्टेड छ भनेदेखि दे क्यान अल्सो ट्रान्समिट टु देयर अफस्प्रिङ्स थ्रु द eggs, right? That's called ovarial transmission. And there's lifelong protective immunity to the infecting serotype, right? Actually, infection bhayeपछि there is the antibodies, IgG antibodies चाहिँ पुरै life भरि नै persist भइरहन्छ, right? And please note, it's protective immunity to the infecting serotype, right? चारवटा serotype छ, त्यसमा जुन सेरोटाइप इन्फेक्ट भयो त्यसको अगेन्स्टमा मात्रै इम्युनिटी हुन्छ. बाँकी सेरोटाइपको अगेन्स्टमा के हुन्छ त्यो एकछिनमा डिस्कस गर्छौँ. ओके, सो द pathophysiology, there is endothelial cell dysfunction. Okay, the virus causes endothelial cell dysfunction and then causing the increased capillary permeability. So capillary permeability increase भएपछि के हुन्छ, from the intravascular compartment the fluid goes to the extravascular compartment, right? That's called capillary leak पनि भन्छ. Capillaries को endotheliumहरुमा dysfunction भएपछि capillaries को त्यो vessel भित्रबाट vessel बाहिर fluid leak हुन्छ. It's also called capillary leak due to increased capillary permeability. So अब fluid त बाहिर leak हुन्छ तर RBCs हरु blood cells हरु धेरै leak हुँदैन. So there is hemoconcentration, right? Increased hematocrit हुन्छ. And there is circulatory insufficiency as there is decreased fluid in the intravascular compartment. As there is decreased fluid in the intravascular compartment, so circulating blood volume decreases. So there is circulatory insufficiency. So decreased perfusion is there, and in severe cases, patient can go into shock. Okay, so that all happens due to endothelial cell dysfunction. Then next there is thrombocytopenia, which is due to molecular mimicry between dengue virus proteins and self proteins. So platelet ma bhayeko proteins चाहिँ dengue virus सँग मिल्दोजुल्दो भएर our own immunity destroys the platelets, right? So that's the reason for thrombocytopenia in dengue infection. And there is also diffuse hepatitis, which also causes inflammation in the hepatocytes. So there can be focal necrosis and steatosis in severe cases. Okay, and this resulting in raised liver enzymes also. And there is also mild DIC because of activation of blood clotting and fibrinolytic pathways. Mild DIC can be there. And then there is CNS involvement. So severe forms of dengue will also have encephalopathy, right? In altered sensorium, because on some features of encephalitis नै भनौँ न, हैन? So dengue virus can also cause encephalitis or encephalopathy. That is due to the direct neurotrophic effect of the virus. But this is not seen in all cases, only in severe cases of dengue infection. And now let's see what happens in there is sequential infection with different serotype. So you have already got infected एकचोटि एउटा serotype ले infection भएर disease भइसक्यो, let's say serotype 1, then 1 virus ले, then 1 serotype ले infection भइसक्यो, अब next then 2 या then 3 ले infection भयो के हुन्छ, the antibodies which are already there can bind the variants but cannot neutralize. So the antibodies will bind to the variants but they cannot kill the virus, okay, but instead there will be increased uptake by the antigen presenting cells. The virus, there will be increased uptake of the virus by antigen presenting cells, and there's activation and proliferation of memory T cells, and there's increased activation of immune system will cause damage to our body, okay, because of the excess cytokines. So जति धेरै cytokines produce भयो त्यति नै capillary leak increase हुने भयो, त्यति नै thrombocytopenia हुने भयो. So there will be more chances of developing dengue hemorrhagic fever or dengue shock syndrome, है, अनि DHF or DSS भनेको dengue hemorrhagic fever or dengue shock syndrome. So already एउटा भाइरसले इन्फेक्ट गरेछ, फेरि एउटा सेरोटाइपले इन्फेक्ट गरेछ, फेरि त्यही सेरोटाइपले इन्फेक्ट गर्यो भनेदेखि बडी विल बी इम्युन, सो डिजिज हुँदैन, इम्युनिटी हुन्छ. बट डिफरेन्ट सेरोटाइपले इन्फेक्ट गर्यो भनेदेखि देयर विल बी मोर सिभियर इन्फेक्सन बिकज द एन्टिबडिज एन्ड द इम्युन सिस्टम gets activated but cannot destroy the virus, okay. So there will be more severe dengue when there is different infection with a different serotype, okay. Now clinical manifestations. So there are 3 phases, okay, in the clinical course of dengue infection. There is 3 phases. One is febrile phase, one is critical phase, and then there is recovery phase, okay. Febrile phase, critical phase, and recovery phase. So in febrile phase there is high grade fever that may last 2 to 7 days, okay. High grade fever lasting 2 to 7 days. There's facial flushing, skin erythema, myalgia, headache, nausea, and vomiting, okay. These are the prodromal features which are seen in many viral infections, okay. Facial flushing, skin erythema, myalgia, headache, nausea, and vomiting. Positive tourniquet test may be seen, okay. Now in the next slide we'll discuss what is positive tourniquet test. It's the test of capillary fragility, okay. The test of capillary fragility. So in the febrile phase, positive tourniquet test may be seen, and minor hemorrhagic manifestations like petechiae and mucosal bleeding is also seen in febrile phase, okay. Liver may be enlarged and tender hepatomegaly, and there may be low leukocyte and platelet counts, okay. Low leukocyte and platelet counts. So mainly febrile phase ma ke hune bhayo, high fever, prodromal symptoms, myalgia, headache, nausea, vomiting, facial flushings, and then minor hemorrhagic manifestations, tender hepatomegaly, low leukocyte and platelet counts, and positive tourniquet test, okay. So what is positive tourniquet test is we do it with the BP cuff. It's also called HES test, HESS, HES test, okay. HES test or positive tourniquet test is done with the BP cuff. So first we measure the BP of the patient. Patient ko blood pressure measure karne, and then we'll keep the blood pressure cuff inflated in between the systolic and diastolic pressures. Systolic pressure and diastolic pressure ko bichama. So let's say suppose 100/60 sa. Blood pressure is 100/60, systolic is 100, diastolic is 60, then we keep the blood pressure cuff inflated at 80 ma rakhera त्यो यसलाई नबले टाइ गरेर राख्ने, 80 मै constantly pressure बनाएर राख्ने. For how long? For about 5 to 10 minutes, okay? 5 to 10 minutes सम्म we keep the blood pressure at between systolic and diastolic pressure, and then we release it, okay. And then after releasing it in 1-2 minutes we'll see the petechiae or these hemorrhagic spots, हैन. So blood pressure generally आमा यतातिर राखे होला, हैन, and then this is the cubital fossa को area तिर we'll see the hemorrhagic petechial spots, and in a 1 square inch area, in 1 square inch area if there are more than 20 spots, then that is the positive HES test or positive tourniquet test. This is the test of capillary fragility which is seen in the dengue fever, okay. Now then next comes the critical phase, okay. Critical phase starts 3 to 7 days from the fever onset as defervescence sets in. भनेको Critical phase begins once fever decreases. Right? Fever decreases. Fever decrease भएपछि then usually parents are happy. अब ज्वरो चाहिँ कम भयो भनेर. But this is it's the critical phase भनेको complications हुने chance बढी हुन्छ यसमा झन् है. So हामी चाहिँ we should be more worried when actually fever decrease हुन थालेपछि then we have to be more worried or we have to do more frequent monitoring because complications can occur. Patient may develop bleeding and shock. There is increased paxil volume and decrease in platelets. And there can be organ dysfunction in the form of severe hepatitis, myocarditis, or encephalitis. Right? So most of the complications are critical phase. So that's why it's called critical phase. Right? Minded fever decrease by and virus destroy viremia is only in the febrile phase, right? If we have a fever, virus destroy mostly but what causes damage is our own immune activation, right? There's a cytokine storm or so in more capillary leak, more thrombocytopenia, severe organ dysfunctions, critical phase moments. Okay, bleeding, shock, increased paxil volume, thrombocytopenia, and organ dysfunctions like severe hepatitis, myocarditis, and encephalitis. Okay. Then is the recovery phase. So after 24 to 48 hours in critical phase, reabsorption of extravascular compartment fluid takes place in another 48 to 72 hours. Okay. So around 24 to 48 hours critical phase सुरु भइसकेर 24 to 48 hours पछि अनि बिस्तारै जुन एक्स्ट्राभास्कुलर कम्पार्टमेन्टमा गएको फ्लुइड हो त्यो बिस्तारै रिएब्जर्प्सन हुन थाल्छ है. एन्ड सो यदि इफ सिभियर कम्प्लिकेसन्स भएन भने पेशेन्ट सकमै गएन सिभियर एन्सेफलाइटिस नै भएन भने बिस्तारै इम्प्रुभमेन्ट हुन थाल्छ है. जेनरल वेलबिङ इम्प्रुभ्स, एपेटाइट रिटर्न्स हैन, ग्यास्ट्रोइन्टेस्टाइनल सिम्पटम्स सबसाइड भनेको त्यो नजिया भमिटिङहरु पनि सबसाइड हुन्छ एन्ड हेमोराइनिक स्टेटस stabilizes, right? Blood pressure, heart rate improve. So recovery phase ma, so vital parameters improve, symptoms are nausea, vomiting, decreased appetite, improve on that, right? And there is typical rash of isles of white in sea of red. Right? So red background ma, small white spots. Isles plural of islands, small islands just the white spots in the red erythematous background. That can be seen, and there is pruritus. Right? So recovery phase more pruritus the himtals, right? So and then there is also increase in leukocytes and platelets. Right? Leukocytes and platelets are bistari increase on the thousand. So recovery phase basically improvement on capillary leak jun fluid extravascular compartment jun gaeko thyo त्यो reabsorb हुन थाल्छ बिस्तारै अरु GI symptoms हरु र hemodynamic status पनि improve हुन्छ. Typical rash, and then pruritus, and increase in leukocyte and platelets. Okay. So this is the typical rash. Red background, there are small white spots. So this type of rash is generally seen in the recovery phase. Okay. Now this is a chart showing the different clinical types. Okay, there is a dengue with warning signs or dengue without warning signs, and there is severe dengue, right? So this is the classification. So when do we call it probable dengue, or when do we suspect dengue in a patient? Okay, so the criteria is live in or travel to dengue endemic area. Okay, so that dengue endemic area ma basya chaina ya travel gare chaina bhanदेखि obviously we will not be suspecting dengue infection. Okay, and fever, and that also the dengue endemic area ma basirako hunu paryo ya त्यहाँ travel गरेको हिस्ट्री हुनु पर्यो, and there has to be fever along with two of the following criteria. Okay? So fever will always be there in the dengue infection, and any two of the nausea, vomiting, or rash. Your rash भनेको सुरुको जुन erythematous rash भयो, and aches and pains भनेको myalgia, Tourniquet test positive, leukopenia, or any of the warning signs. So your fever along with any two of the following, then you can clinically call it probable dengue. Okay. once laboratory confirmed by laboratory test or laboratory test what infection confirmed by that's called confirmed dengue or just dengue, right? Clinical laboratory test or confirm bad, but clinical features they will just say it's probable dengue, right? And then there are warning signs. Right? So what are the warning signs? Abdominal pain or tenderness, persistent vomiting, right? Clinical fluid accumulation. Clinical fluid accumulation, pleural effusion or ascites or pericardial effusion. So fluid accumulation, right? And then mucosal bleed. So epistaxis, yeah. So oral mucosa about a bleed by racemia. That's also one of the warning signs. Lethargy and restlessness. If this patient is very lethargic and restless, that's also one of the warning signs. Hepatomegaly is also warning signs. Liver enlargement more than 2 centimeters is warning sign. And there are the laboratory parameter increase in hematocrit with concurrent rapid decrease in platelet count. So thrombocytopenia with increase in hematocrit is also a warning sign, right? So यसमा दुईटा या बढी फिचर भयो दुईटा या बढी वार्निङ साइन्सहरु छ भन्दाखेरि we call it dengue with warning signs, right? Maybe either probable dengue with warning signs or confirmed dengue with warning signs. If warning signsहरु छैन भन्दाखेरि we'll say just dengue without warning signs or probable dengue without warning signs भनिन्छ, हैन? Severe dengue को फिचर भनेको चाहिँ that's even dengue with warning signs भन्दा पनि severe भयो, हैन? Severe dengue main तीनटा फिचर is severe plasma leakage, severe hemorrhage, or severe organ impairment. So जुन त्यो capillary leak हो त्यो basically एकदम धेरै भयो भने त्यतिखेर हामी severe भन्छौँ है. Severe plasma leakage leading to shock, है. Hypotension नै भयो, blood pressure नै कम भयो, shock नै भयो भनेदेखि that is severe plasma leakage or fluid accumulation with respiratory distress. यति severe pleural effusion भयो कि respiratory distress नै भइरहेछ या ascites causing respiratory distress, right? So any form of fluid accumulation leading to respiratory distress is also severe plasma leakage. And severe bleeding, एकदम धेरै bleed भइरहेछ, the hemoglobin एकदम drop भयो या clinically evident नै epistaxis मात्रै नै भयो पनि त्यो continuously भइरहेछ, stop नै भइरहेछ छैन भनेदेखि then it's a severe bleeding, then we'll take it as severe dengue infection. Or in if case of severe organ involvement, AST or ALT, liver enzymes, if they are elevated more than 1000, then that is also taken as severe hepatic involvement. And see if there is impaired consciousness, that is also severe brain involvement. And heart or other organs, like for example, heart co function may impair by ejection fraction severely reduced by that is also a severe organ involvement. So any one of these, then we'll call it as severe dengue. Okay, and these are the warning signs. So, okay. Now, differential diagnosis. What can be other diseases which can mimic like dengue? So, any flu-like syndromes, influenza, measles. So, yes, the chikungunya, infectious mononucleosis. So, any because all these viral infections will have nausea, vomiting, myalgiaहरू यो इन्फेक्सन्सहरुमा पनि हुन सक्छ है. And sometimes dengue पनि slight यो running nose त्योहरू अलि भेटिन सक्छ. So these are the differentials. I mean other infectious मा acute gastroenteritis, malaria, leptospirosis, they can also have similar features of with dengue. Or typhoid, scrub typhus, viral hepatitis, bacterial sepsis or septic shock, they can also be the differentials. Now, and other illnesses with neurological manifestations, right? So severe dengue might be sensorium may altered by consciousness impaired by the differences that we think of is meningoencephalitis or encephalitis and febrile seizures. Okay, so any other diseases with viral prodromal symptoms, any other diseases with GI symptoms, gastroenteritis, nausea, vomiting, along with loose stools, obviously fever, any infections with high fever, and any infections with neurological manifestations, they can be the differential diagnosis. Okay, which will differentiate on the basis of clinical features and laboratory findings. Now, what are the lab investigations that we'll do? Complete blood count. So, complete blood count will show increase hematocrit. I will discuss that capillary leak. So fluid चाहिँ बाहिर जान्छ RBCs हरु चाहिँ extra intravascular compartment हुने भयो that's why that causes increased hematocrit low platelet count and decreased leukocyte count with increased lymphocytes right so thrombocytopenia हुने भयो hematocrit चाहिँ increase हुने भयो but there is thrombocytopenia and decreased leukocyte count तर त्यो leukocyte count मा lymphocyte predominance भएको हुन्छ because it's a viral infection so mainly lymphocytes चाहिँ slightly increase भएको हुन्छ and in the serum there is decreased albumin and increased level of transaminases so SGOT and SGPT are increased and there is more prominent increase of SGOT than SGPT in dengue okay so SGOT भनेको AST is more prominently increased than ALT okay and there's low sodium increase there may be low sodium increased urea creatinine and acidosis okay the severe forms of dengue infection ma low sodium increased urea creatinine and acidosis may be there and chest x-ray may show pleural effusion so fluid accumulation haru huna sakcha so chest x-ray ma mild pleural effusion huna sakne bhayo and USG abdomen may show ascites and enlarged gallbladder again abdominal cavity ma pani such fluid accumulation huna sakcha gallbladder pani enlarged and edematous huna sakcha right so these are the USG findings and how will we confirm the diagnosis okay direct method is by NS1 antigen detection NS stands for non-specific so sabai serotype huncha NS1 antigen right so if you detect NS1 antigen then that is a very specific for dengue infection right but that is the NS1 antigen can be detected only in the initial period when there is viremia actually antibodies or virus destroy NS1 antigen is not detectable okay so initial 5 to 10 days ma you may get NS1 antigen positivity and then you stop भयो भनेदेखि फेरि त्यही लिंकबाट जोइन गर ल okay so NS1 antigen is the conformity test and other method of confirming it is by virus isolation by culture or genome detection by PCR so these are not the commonly used method but virus नै isolate गर्यो PCR बाटै genetic material नै detect भयो that is also a confirmatory method okay and then indirect method is IgM detection and IgG detection okay so dengue virus ko against ma IgM ra IgG detect गर्यो भनेदेखि that is an indirect method IgG is not reliable किनभने that can be also due to past infection भइरहेछ भने IgG will be persisting but IgM will be present only in the recent infection right few months पछि IgM disappear पछि के हुन्छ so if there is IgM positivity then it's highly suggestive of a recent dengue infection okay so mainly हामीले गर्ने भनेको NS1 antigen and dengue IgM okay so yes सुरुको स्टेजमा NS1 is more helpful पछि NS1 5 to 7 days पछि चाहिँ NS1 may not be detectable त्यो बेलामा चाहिँ IgM is more helpful right IgM सुरुको स्टेजमा IgM may not be detectable सुरुको स्टेजमा जब severe viremia भएको हुन्छ त्यतिखेर antibody may not be positive okay now let's come to the management dengue infection without warning signs so warning signs haru chaina severe dengue pani chaina just a probable dengue or confirmed dengue without warning signs छ भने it's not that difficult just fever and body aches are treated with paracetamol encourage plenty of oral fluids हैन it's अहिले अब febrile phase मा मात्रै छ भनेदेखि त्यो warning signs हरु केही नआएको हुन सक्छ but later patient may develop so oral fluids चाहिँ plenty encourage गर्नु पर्छ so that the capillary leak does not cause decreased circulatory volume perfusion impaired nerves and we have to encourage plenty of oral fluids and then monitor the patient for warning signs along with hematocrit and platelet counts so patient लाई monitor गरिराख्नु पर्यो कुनै warning signs develop गर्ला कि hematocrit increase हुँदै जाला कि thrombocytopenia होला कि and then severe capillary leak भएर अरु complications आउला कि भनेर monitor गर्दै जानु पर्यो है so mainly just plenty of fluids encourage गर्ने fever र body ache हरुको लागि paracetamol दिने and then we have to monitor है mild symptoms मात्रै छ भनेदेखि we need not admit just होम बेस्ड ट्रिटमेन्ट नै होम बेस्ड म्यानेजमेन्ट नै गरेर हरेक एभ्री डे फलोअपमा मात्रै बोलाउन पनि सकिन्छ ठिक छ and then if there is dengue with warning signs then we have to hospitalize okay so we hospitalize so what are the warning signs you any abdominal pain tenderness persistent vomiting clinical fluid accumulation mucosal bleed lethargy restlessness hepatomegaly more than 2 centimeter or increased hematocrit with concurrent thrombocytopenia. These are the warning signs. So, this what will we do? We'll hospitalize and we'll give ringer lactate or normal saline at 7 ml per kg per hour for 1 hour. Maybe 7 ml per kg fluid binge. And then we'll assess at 1 hour. We'll assess the vitals and we'll also check the hematocrit. Okay. If there is improvement, if vitals are improved, hematocrit normal is how vitals are hospitalized गर्दाखेरिको भन्दा अलिक इम्प्रुभ भएको छ भनेदेखि will decrease the fluid है will decrease the fluid to 5 ml per kg per hour है पहिला 7 ml per kg थियो इम्प्रुभमेन्ट भएको छ भनेदेखि तुरुन्तै डिक्रिज गर्नु पर्यो 5 ml per kg per hour त्यसपछि फेरि 1 घण्टामा एसेस गर्यो if there is further improvement then will decrease to 3 ml per kg per hour and then बिस्तारै टेपर गर्दा discharge when the patient is stable for 24 to 48 hours at least 24 to 48 hours चाहिँ हामीले पेशेन्टलाई without fluid नै हस्पिटलमा भाइरसहरू एकदम राम्रो मेन्टेन भइरहेछ भनेदेखि then we can discharge right so improve भइरहेछ भने छिटो fluid टेपर गर्दै जानुपर्छ है नत्र again there will be fluid overload हैन because हामी के भन्यो रिकभरी फेजमा के हुन्छ fluid को absorption हुन थाल्छ fluid को absorption पनि भइरहेछ हामीले जन fluid पनि दियौं भनेदेखि again that will be counterproductive fluid overload हुन सक्छ so improvement so frequent monitoring गरिराख्नुपर्छ improvement हुँदै गइरहेछ भनेदेखि fluid taper गर्दै गएर once the patient is stable for 24 to 48 hours then we'll discharge okay but अब hospitalize गर्यो and then we give fluid normal saline or RL at 7 ml per kg per hour and then 1 घण्टामा भाइरसहरु र hematocrit assess गर्दाखेरि if there is no improvement vitals चाहिँ improve भएको छैन या झन् worsen भएको छ भनेदेखि we have to increase the fluid to 10 ml per kg per hour है and then again assess at about अर्को 1-2 घण्टा पछि हैन at 2 hours फेरि assess गर्यो and then there is again no improvement then 15 ml per kg per hour मा fluid increase गर्ने है so ml per kg per hour भने बुझिन्छ नि जस्तो 10 kg को बच्चा हो भनेदेखि 15 ml per kg per hour will be 10 into 15 is 150 ml per hour हैन so 10 kg को बच्चाको लागि 15 ml per kg per hour will be 150 ml त्यस्तै 7 ml per kg per hour will be 70 ml per hour है per hour okay so 7 ml per kg ले दियो 10 त्यसपछि इम्प्रुभ भएन 10 ml per kg per hour ले दियो फेरि इम्प्रुभमेन्ट भएन we increase to 15 ml per kg per hour अझै इम्प्रुभमेन्ट भएन then we have to give colloids भनेको हामी युजुअली दिने colloids भनेको albumin है because intravascular compartment जति fluid दिए पनि intravascular compartment fluid retain भइरा छैन भनेदेखि we have to give colloid okay and we'll also look for anemia acidosis and myocardial dysfunction and treat according right so उसमा anemia छ भनेदेखि we'll have to suspect कि कतै hemorrhage bleeding भइरहेछ कि we need to give blood हैन acidosis usually fluid दिँदै नै acidosis improve हुँदै जान्छ and if there is myocardial dysfunction ejection fraction very low छ भनेदेखि we have to give inotropics like dobutamine जसले चाहिँ cardiac contractility improve गरोस् है usually we use dobutamine okay so anemia acidosis and myocardial dysfunction छ भनेदेखि we have to treat accordingly okay now if in case of severe dengue भनेको either severe plasma leakage or severe bleeding or severe organ dysfunction okay severe plasma leakage severe bleeding or severe organ dysfunction छ भनेदेखि will say it is a severe dengue so severe dengue मा के गर्ने normal saline or RL at 20 ml per kg okay 20 ml per kg over 1 hour or as rapid bolus right depending on the situation patient एकदमै sick looking छ एकदम lethargic छ भनेदेखि rapid bolus within 10 to 15 minutes नै दिन पर्यो हैन or if you can see कि धेरै sick छैन भनेदेखि you can give over 1 hour and if there is no improvement in vital parameters and hematocrit has increased, right? Then we'll give colloids at 10 ml per kg. If balance improve भएको छैन, heart rate, respiratory rate improve भएको छैन, and increase hematocrit छ भनेको normal भन्दा increase hematocrit छ भनेदेखि we'll give colloids, ठिक छ, to make the fluid retain in the intravascular compartment. If there is no improvement and hematocrit is decreased, then we give blood transfusion, right? Because एक त improvement भइरहेको छैन, त्यहाँ hematocrit increase नभइकन झन् decrease भइरहेछ भनेदेखि that suggests कि bleeding भइरहेछ, हैन? Maybe obvious bleeding, epistaxisहरू भएर या GA bleed भएर, it may be some obvious bleeding or it may be some internal bleeding which we cannot see, हैन? हामीले नदेखिरहेको internal bleeding पनि भइरहेको हुन सक्छ. So patient worsen भइरहेछ र hematocrit decrease भइरहेछ भनेदेखि will consider it is a there is bleeding, so we'll give blood transfusion. But patient improve भइरहेको छैन र hematocrit increase भइरहेछ भनेदेखि then we'll give colloids, ठिक छ. Now if patient is in shock, then oxygen पनि दिनु पर्यो. Shock भन्ने बित्तिकै perfusion is low, so the oxygen carrying capacity is low, so we have to supplement oxygen. And there is management of bleeding and fluid overload. So केही गरी fluid overload नै भयो, हामीले केही गरी proper monitoring गरेनौं त धेरै fluid दिइराख्यौं भनेदेखि patient can go into fluid overload. So त्यसको लागि again then अब fluid restriction गर्नु पर्यो, fluid बाहिर निकाल्नु, diuretics दिएर fluid निकाल्नु पर्यो, हैन? त्यो सब गर्नुपर्ने हुन्छ if they are there. And proper monitoring throughout the treatment. Okay, this is very essential. Throughout the treatment, proper monitoring चाहिन्छ dengue को patient लाई. Okay, because त्यो एकदम rapidly worsen भन्छ, admit गर्दाखेरि ठिकै छ तर capillary leak increase भयो भने rapidly worsen हुँदै जान्छ. So we have to fluid दिनुपर्ने भयो, हैन? अर्को अब fluid दिइरहेछ तर patient लाई फेरि recovery phase मा गयो तर हामीले fluid फेरि दिएको